Psychiatric illnesses, mental illnesses are also true, and they are because of changes in the body. And people want to achieve success at a very short period of time.
Words we call it as stress, depression, anxiety. How do you treat mental illness? What are the ways? Any equipments are there to treat?
It's very important to identify that when you are under stress and how to manage stress effectively. Patients with mental illnesses are dangerous, they are violent, that thing still there.
Hello, friends. Welcome back to our channel, Life Beyond 22 Yards. Now, we all know in this competitive world, day to day life, every human being is trying to strive for success, for fame, for better standard of living. So he's putting his hard work day in, day out. So when we speak about success, when we speak about striving hard to make his life better, unknowingly we are going through some challenges within ourselves. Those in technical words we call it as stress, depression, anxiety. So today we'll be discussing on these lines. How do we identify these things? How do we consult the right people, and how do we overcome these things? So to discuss more about these things, I will. I'm very happy to welcome Dr. Samir Belvi Mangalwedhe. Dr. Samir, thank you very much
Thank you,
for giving
pleasure.
us your time and obliging to share your information regarding the subject. So basically, Doctor, do you feel that in today's world where everybody is striving hard in the competitive world, people undergo stress or depression or anxiety or what?
Yeah, good afternoon to all. First of all, thanks to Abhijit for this opportunity. For those who his followers, I would like to put it on record that we played cricket together as youngsters, and we had a lot of good memories, and I still cherish those memories. And I'm very happy for Abhijit for what he is doing in terms of spreading awareness and creating public awareness, and especially for his channel. And I wish him all the very best.
Thank you,
Uh,
Samir.
Coming to the topic, yes, as he put it rightly across, that today is a competitive world, 21st century. There is a rush for everything, and people want to achieve success at a very short period of time. There is a lot of competition at every stage of life, and invariably, this leads to a physiological state that we call as stress.
Okay.
So, and uncontrolled, unregulated stress leads to psychological problems like anxiety and depression, which is very common these days. We see these problems of anxiety and depression secondary to stress in lot of patients, from school going children to successful persons to businessmen to elderly people. So everybody goes through this phase, and
Thank you, Samir. The reason why we chose Samir is we felt he's the right person to understand the situation because he's in the what we call in the cricketing terms, it's a semi-new ball. He knows how the older generation is, how the younger generation is coming. So he'll be able to guide us better. Samir is the associate professor, Department of Psychiatry, KMC Research Center. So Samir, now normally the people speak about mental illness. Normally, what happens if I'm having a pain in my elbow or anywhere? So I go and meet the physician. I go and meet the orthopedician. But if something related to the mind, we normally hesitate. We feel that oh, what the others will think. Means it's a stigma.
yes.
So my first question is: does the mental illness exist, and how do we? If yes, how do we overcome it?
Yes, like any other physical problems one experience. Say, for example, if I have to say that there are physical problems like diabetes and hypertension, endocrine problems, heart related problems. So, when we call them diseases of different parts of the body, similarly, there exists disease or illness of mind,
Okay.
which we collectively call as mental illnesses or psychiatric illnesses.
Okay.
What I want to make point here is, like, there is changes in the body when somebody develops hypertension, when somebody has diabetes. Similarly, there are changes in the body, in the brain chemicals that leads to psychological problems like anxiety and depression.
Okay.
So, like any other physical problems, be it pain or be it diabetes or hypertension or be it some other chronic medical conditions, psychiatric illnesses, mental illnesses are also true, and they are because of changes in the body.
Okay.
Unlike popular belief, where people think that mental illnesses are because of weakness, mental illness are because of somebody's uh, low confidence, or
Mhm.
mental illnesses are self-made.
Mhm.
So that's not the case. So mental illnesses are true illnesses like any other physical problems.
Okay. Suppose an individual is going through stress, depression, and all. How, at what time, or how does he identify that he is undergoing medical or mental illness?
It's a very good question, like how to identify somebody when they are suffering from stress or mental illnesses. So, like physical disorders, like there could be fever or there could be pain somewhere, which tells us that we there is something wrong and we should go and consult. For mental illnesses, the most common or most commonly seen problems that people have in the beginning is changes in their mood.
Mhm.
So they become unhappy without reason,
Okay.
they become fearful, they get anxiety without any reason, or suddenly they start to lose interest in their work, in their family, in their life
Mhm.
without any reason. They don't get sleep for days together, they can't fall asleep, their appetite goes, they don't feel like eating, and most importantly, their interaction with their family and colleagues goes down. They don't like to talk, or sometimes they may become very irritable for no reasons.
Okay.
So these changes are different from how the person was before the onset of mental illnesses.
Okay.
So most commonly they start to having changes in their mood. Okay,
Mhm.
and as days pass, their behavior changes. Sometimes they become withdrawn. They don't like to talk to anybody. They don't go out of the house. They stop going to work. These things sets in. So these are the small things that tell us that there is possibility of some mental illnesses. And most of the time, more common mental illnesses also come to us with pains here and there which cannot be explained by medical diagnosis.
Okay.
Unexplained headache,
Uh-huh.
body pains everywhere for many days or months together,
Mhm.
for which there is no physical cause. So even that is a presentation of
Okay.
stress and mental illnesses.
Okay. Because this is a very common saying. They say, "What you think is how you feel is how you act." So
Yes, yes.
everything is in
Exactly.
the
Yeah,
mind.
so the mind is a master organ. It
Okay.
controls our mood, emotions, our behavior. It
Mhm.
also controls how our internal organs function.
Yeah.
So something wrong there affects the entire body in different ways.
Correct. But currently, Samir, the thing is, in the society where we live in, people are hesitant to consult a psychiatrist.
Yes,
They
yes,
feel that, oh, this person is psychiatrist means the way people look at him is like, oh, he'll be very violent,
yes.
he'll be very aggressive, he'll speak all nonsense things. So, is it true or how is it?
Stigma with mental illness is still very much evident in our society even today.
Okay.
As you rightly said that people judge. If
Hmm.
somebody says that I had visited a psychiatrist,
Hmm.
then immediately the reaction of others will be, oh, there must be something wrong. That typical perception that patients with mental illnesses are dangerous,
Ah.
they are violent, that thing still there. Or most commonly people feel that you have consulted a psychiatrist, then probably you must be having some problem, you are weak mentally,
Hmm.
your
Yeah.
confidence is low, you cannot face common problems. So these kind of common perception and comments starts coming in. So for that, the stigma is still there. But looking at the past 15-20 years, I can say that things are slowly changing for the better.
Okay.
Things are slowly changing for the better. At least some educated class people are now openly accepting that seeing a psychiatrist is not bad, rather it is required.
Yes.
So without hesitation they come and seek help. And also we need to really look at and thank celebrities and film stars and sports stars who have openly come and expressed that they have gone through psychological problems in the past,
Yeah.
They are trying to educate people that it is a common problem, anybody can suffer from mental illness.
Right.
Deepika Padukone did that. Virat Kohli did that. Recently, Dinesh Karthik spoke about his tough times when he had psychological symptoms. So that is also helping. So people are openly coming out and expressing, helping us to reduce or fight the stigma associated with mental illness. But still, there is a lot of work yet to be done.
Okay. Like as you rightly said, in all profession things, be it the corporate life or the sports thing, psychiatrist or psychology is a very vital subject now.
Yes.
So players do consult a psycho, not because they are mentally weak or whatever, but it's been a routine. Like how we have a physio in the team, we also have a psychiatrist in the team. So now we discussed about mental illness, how to identify mental illness. Now, how to treat means how do you treat mental illness? What are the ways? Any equipments are there to treat methods or treatments are there, or how is it?
Yeah, we have different treatment modalities, and treatment depends on what type of mental illness the person is suffering and how severe is the problem. Most common when we talk about anxiety and depression in an early stage or in a mild form, uh, usually just counseling,
Okay.
what we call it as supportive psychotherapy, or we also call it as cognitive behavior therapy. So it's nothing but a structured way of counseling. So usually counseling helps in a milder forms. So not everybody requires to take medications.
Okay.
So there is also this misconception that patients who take psychiatric medications, they are addicted to that medications for lifelong.
Yeah,
Yeah,
yeah.
people believe that, so they say like I don't want to take medications. So for mild common problems, for milder problems, medications are usually not required. Counseling therapies help, so patients get better. Where there is a moderate to severe intensity of problem, we need to treat with medications.
Okay.
And medications are also not life for lifetime. Okay, most of the problems, medications are there for the treatment duration, and after that, once the patient gets better after a certain duration of time, we try to take the patient off medications and manage. For some severe mental illnesses, uh, they require medications even after getting better, because stopping medications will only make the disease come back
Come
again.
back.
So those conditions are very less. Most common conditions like anxiety and depression, patients are treated for a certain duration of time. Once they get better, once they are back to their normal life, generally the need for medication doesn't persist beyond certain time.
Okay.
So, other than medications, we have other techniques like ECT. Shock therapy is what commonly called for very severe conditions. Uh, Unlike what is shown in movies and other things, it is not that bad.
Okay.
Okay, it's a very painless procedure, if I can say. Patients don't feel anything. And modern techniques like what we call as magnetic stimulus,
Okay.
transcranial magnetic stimulus, and transcranial direct current stimulus. So they are latest techniques to treat mental illnesses, and I'm very happy to say that those instruments are available with us at Hubli.
Very nice.
And other than Hubli, only centers like Nimans or Manipal in Mangalore have those facilities.
Okay.
So we are one of those government institutes, or probably only government institute where that advanced treatment facilities are also available, and we obviously do it free of cost. So yes, modern treatment facilities are different. Now you can't say or recognize anybody who is taking psychiatric medications by looking at him and say he's taking medications. 30 years back that was the case, because medicines were different. They used to have a lot of side effects,
Okay.
and nowadays it's very safe. A
Okay.
lot of options, very safe medications, and other treatment facilities are also available.
Okay. So, Samir, an interesting thing strike my mind. Like when you meet a patient for the first time, how do you gain that trust in that patient to open up with you? And also, once you treat the patient, is leaving. How do you instill the confidence that he can go back and lead a normal life?
Yes, it's a very good question. Most of the time, the trust between the patient and doctor is not a one time thing.
Mhm.
It takes more than 2 or 3 sessions
Okay.
to develop that trust,
Mhm.
and it is more common and especially important in psychiatry. So for us, it is important that we spend time with the patient.
Okay.
We listen to the patient's problem. We try to understand uh, the problem from their point of view. Uh, we are not here just to make some diagnosis and write medicines. So we need to understand what exactly is happening with the person,
Okay.
and that takes time. So usually 2 to 3 sittings sometimes, or even more. So once that trust is developed, communication becomes easy.
Yeah.
So if I have to suggest something, if I have to do some kind of a counseling, so that becomes easy from the patient's point of view, that how he receives it and how he works on it. And once the patient gets better from his problem, from his psychological problems, naturally his confidence will increase, his self confidence will come back, his self esteem will come back. Once they start feeling better about themselves, and they know that how the treatment or the therapy has helped them, it is much easier to convince them to continue what they are doing, be it taking medications or be it in the therapy, and whatever plans we have for the patient after they go back to the
Mhm.
society and how they restart their life. So that becomes easy.
Okay.
But yes, it's a time taking procedure, and but eventually we get to achieve that with every patient.
Okay. Um, Samir, one last question. You explained all the things. How do we get into it? How we can come out of it? So, you want to give any message to the society, be it the youngsters, be it the people from all walks of life? Any message so that how they can prevention is better than cure,
Yes,
they
yes,
say.
exactly.
So, how can we
Uh,
do that?
so it's a very important point. What you made is prevention. So
Yes.
yes, we can be proactive, and we can work in a certain way so that we prevent the bad effects of stress, and we can prevent the onset of some psychological problems. So few advices which I usually give to my patients is basic lifestyle. You should have a healthy lifestyle.
Okay.
By that again, I mean you should have 6 to 8 hours of adequate sleep, no smoking, no alcohol, and physical activity in
Okay.
any form. I mean, I know that since childhood we have been into some kind of sports, and sports or some kind of physical activity actually has a beneficial effect on mind and how do you deal with stress.
Okay.
Okay, so physical activity is a must. Healthy lifestyles. Uh, Try to manage work and family life. You can't do one thing more than the other. uh, Other things like being social, be a part of organization, do some kind of a charity work,
Mhm.
be in a group. Ventilation, discussing, talking about your problems helps a lot. Most of the time small issues, small problems that could be work related,
Mhm.
or some personal relation
Yeah.
issues related, they get solved immediately by discussing and talking to your closed ones, family or
Correct.
friend.
True.
Nowadays it's very important that you talk and ventilate and express your feelings. Avoiding social media, and this is very important for youngsters these days.
Okay.
uh, Not everything which is there on social media is true,
Yeah.
and people easily get influenced, especially youngsters. So they have to be very selective in what they watch and what they learn from that. That is also important. And more important in all these things is, if you feel that even in spite of all these things, something is bothering you,
Yeah.
you're not able to enjoy your life, you're not happy, you're restless, you're troubled by some event or activity, or something is bothering you, talk to someone. If that person is not able to help you, don't hesitate to seek professional help. Okay,
Yes.
you need not necessarily visit a psychiatrist always. There are psychologists. I
Mhm.
think now some schools and colleges also have counselor there
Counselors.
at their campuses. Talk to them, talk to professionals,
Okay.
because they can understand what you can't understand. So
Definitely.
talking to professionals is also very important. Don't hesitate, don't delay. uh, don't give in to stigma or that feeling of
Okay.
uh, am I mentally strong, or why should I go and seek a psychological help? So that should not happen. So overall, healthy lifestyle is a must. Proper sleep, physical activity is a must, and that's how you manage. That's how you can not only be physically well, you can very well be mentally well also.
Correct. Thank you,
Yeah,
Samir.
yeah,
So the message is very loud and clear. Take care of what your inner sense is speaking. It's not only about how you look. Even though you are looking very strong, you might be terrible inside. So take be very clear, be very transparent, be very honest to yourself. If anything is bothering you, please reach out to the right people. So on behalf of all my viewers, uh, Dr. Samir, I thank you very much once again for giving us so much of inputs. I'm sure all my friends take note of this and make sure we all strive to make our lives more better, our quality ones. So thank you guys. Next time again we'll come back with a new interesting topic. Till then, take care. Good luck.
thank you,
Thank you,
Abhijit.
Samir.
Thank you.